This morning we gave them to the lab, and that can take care of 4,000 tests. Now, we are also through the Indian Fund and other funds, USAID, DFID, we are purchasing to the tune of almost 20,000 tests. So I have a feeling by the end of next month there will be a lot of test kits in the system that anybody who needs to get tested will get tested. My fear is we don't test anybody who just wants to know their status, but test those who really need to be tested. Who needs to be tested happens to be anybody who has fever, cough, what was the third one? Chest respiratory symptoms. If you have respiratory symptoms, that is a bigger alert. So any of those, once you have that, and you have been in contact with somebody who has been tested positive, you need to be tested immediately. And I think all healthcare workers also need to be tested because they are treating everybody. So we have to know that they are safe before they can treat anybody. Otherwise, if you don't test healthcare workers and they are out there treating people, only to realize that, oh, well, I've treated 10,000 people, but I myself happens to be positive, I would have exposed all of them. So I think all healthcare workers must be tested. Police, who are out there all the time, need to be tested. Prison warders need to be tested. Prisons, the geriatric home need to be tested. So I think those subpopulations need to be tested, plus those with the symptoms. Now we're expecting, that is if everything stays the same for a while, and we still have the partial lockdown as we do have, we are likely to have 785 cases or so, around 700 cases. However, if we drop everything on June 3rd, we are likely to have over 10,000 cases. So definitely we cannot lift our advice to government is not to consider lifting all the measures at the same time. So probably a phased approach, and it's up to government to review that and come up with something. But definitely, I think we are doing well. The effective reproductive number has fallen. Now it's about 1.3, which is every positive case affects 1.3 persons. So, and this number came from 3.5, now gradually falling. So it is a good sign. But even though it's a good sign, we cannot stay like this forever. That means that we need to make sure that it's down to a point that the healthcare system can take care of any positive cases that come as a result of opening the system. Because if you open the community up and suddenly you have 100 cases a day, the health system will be overwhelmed. And that's what we have to guide against. So a gradual process so that the healthcare system can also keep positioning itself to be able to react to whatever cases we are getting.